All right, we are joined with Dr. Rollins again, and today we're discussing dairy, and a new study is saying that maybe some of the things we've always thought with some dairy products aren't necessarily true.
That's right, thank you. Yeah, there's been some news recently. A great big study in Sweden has kind of turned what we thought about milk, especially in women protecting their bones. It's turned what we thought on its head. It may be that milk does not do a body so good after all.
Wow.
These researchers looked at about 100,000 people and followed them over 20 years and distinguished between milk and fermented milk products like yogurt and cheese. And what they found was pretty astounding. The women who drank more than 3 glasses a day, the most milk drinkers compared to the least milk drinkers, had about a 60% increased risk of hip fracture.
Wow.
This was kind of stunning from what was expected. They also found about twice the rate of heart disease and a 70% increased risk of cancer in the milk drinkers. Interestingly, in the women who ate more dairy and cheese, fermented milk products, they found kind of the opposite. And we don't really know exactly why. It may be that milk has a lot of hormones in it that has estrogens and growth factors designed to grow a baby calf very well.
Sure.
And it may be that human adults don't do so well with these growth factors.
Sure.
Another interesting theory, though, is milk sugar, lactose, is broken down to glucose and galactose. And we've known for a long time that galactose will cause inflammation in the body. That may be the link. We don't really know for sure, but it's kind of a startling finding. Now, they didn't find the same results in men. They found a slight increased risk of heart disease in the milk drinkers in men, but not these bone findings. So there are, to be fair, there are some other studies that show that milk can help bones, but they're smaller studies and shorter studies. So this is one of the biggest, most powerful studies we've seen. So if you're drinking milk thinking like, I grew up drinking whole milk. Milk does a body good, right? And you see the healthy models with the milk mustaches, strong bones.
That's right.
It may be that this is not what we thought it was. So if you're trying to build strong bones with milk, I think I'd look elsewhere.
Okay, and where would you look necessarily?
So along those lines, how do we build strong bones? Basically, one of the most important things is our sex hormones, estrogen and testosterone. Those are the hormones that tell your body, hey, build bone. They turn on the DNA.
Okay.
You need thyroid to run the metabolic machinery. You need enough vitamin D. If you don't know your vitamin D level, have your doctor check your blood and find out what your vitamin D level is. Most of you out there are deficient. There's an epidemic of low vitamin D, and you need vitamin D to even absorb calcium. So I recommend that people consider hormone replacement if they're past menopause or aging men. That's a controversial area we do a lot of work with, and I would ask you to look for one of our upcoming free seminars. Over the next month or so, we have these pretty routinely. We have a bioidentical hormone replacement for women and another one for men. You can go to my website and just sign in for the newsletter, and you'll see the upcoming events there. So look for that kind of information and look for those seminars.
All right, very good. Well, some mind-boggling information learned today. All right, if you have any questions for Dr. Rollins, there's the information right there on your screen. We'll be right back after the break.